I think he's been a disaster. It's chaotic.
What is your assessment of how well he has performed over what is not yet even a year and a half in the job?
Well, look, to be honest, I think he's been a disaster. Streeting came in, he had one job. I mean, the government was elected on the basis of stopping the boats, fixing the economy, and shortening waiting lists. As far as the NHS was concerned, I thought he would come in and have an absolute resolute focus on cutting waiting lists. Well, he sort of started off by talking about it, and then out of the blue, with nothing in the manifesto, nothing at all, he suddenly said, well, we're going to merge NHS England with the Department of Health. And there are reasons for that. There was a certain amount of duplication, mainly in the Department of Health, not in NHS England. But merging those two, it makes sense. But that means the focus, the top team shifts. Then we've got then he said, well, we're going to have a 10-year plan. And, 10 years means nothing really to people working in the NHS. And it's only a 3-year plan anyway, by the time it was published, because it will take us up to the election. On top of that, along came Lord Darcy's report and assessment of the state of the NHS, where he made it clear that it was underfunded, understaffed, the buildings were falling down. I mean, it was a horrible report. So suddenly, on top of all the pressure of doing the waiting lists, we've got all the distraction. And of course, the latest distraction is that we're going to lose half the staff in integrated care boards, and no one knows which half, and no one really knows who's going to pay for the redundancy. So it's chaotic.